Interface Video presents Fairhope Hospice Today. Brought to you by Fairhope Hospice and Palliative Care, Fairfield Federal Savings and Loan, Fairfield Medical Center, the Fairfield County Board of Developmental Disabilities, Dagger Law, and the Frank E. Smith Funeral Home.
Hi, I'm Kristen Glazier, President and CEO of Fairhope Hospice and Palliative Care, home of the Pickering House. Thank you for joining us on Fairhope Hospice today. We are currently at our new palliative AIM clinic here at 1319 East Main Street, and we've got some pretty special guests with us today. So we're really excited to share with you our newest and latest addition to the Fairhope family. And joining me today for this segment are two of our nurse practitioners. Welcome.
Thank you. Thank you.
Go ahead and introduce yourselves.
My name is Nicole Demastri-Colicon. I'm one of the palliative care nurse practitioners here at Fairhope, and I've been with Fairhope for about 2.5 years now.
My name is Becky Tash. I'm a palliative nurse practitioner. I've been here for about 1.5 years now.
So thanks for taking some time out of your day to join us, and we're just gonna talk a little bit about this whole thing, palliative, and really how Fairhope got started with our palliative program. I don't think a lot of people know until recently we've been shouting from the mountaintops about what palliative care is and how long we've been taking care of palliative patients in this county and our surrounding areas. So. Palliative has been a part of Fairhope for probably at least 20 years, and not a lot of people know that. I remember one of the nurse practitioners we're going to speak to here in a little bit has been with us for a while, and I remember a time about 8 years ago when we had a celebration when we hit 80 patients. So today we are currently serving a little over 300 patients in this community and in the counties that we serve. So we felt and have seen the growth in palliative care over the last several years, and just really felt like this was going to be the next move for us. So I wanted to just take a little bit of time and talk to you about the goal here at the palliative clinic, the Fairhope Palliative AIM Clinic, Advanced Illness Management, and really talk a little bit about what we do, what our goal here is, and share that with you, hopefully get some questions answered, and just educate you today on what we do here at our office. Again, it's located at 1319 East Main Street, right around the bend from Ewing, so North Ewing, so it's very close to the hospital, which is really ideal for us. And we're going to talk a little bit about our great partnership with Fairfield Medical Center here soon. So can we talk just a little bit about what palliative care really is? Because I know that oftentimes people don't understand the difference between palliative and hospice, and I really want to focus on the differences between those two. And even though this AIM clinic is a part of Fairhope, it is not a hospice service. So you want to start a little bit talking about the differences?
Sure. So in palliative care, we take care of patients who have a chronic illness and an advanced illness, and we help with symptom management. So our patients range anywhere from COPD to heart disease to oncology patients. And a lot of times those patients are receiving treatment and are not ready for hospice, either clinically or philosophically. And so we help fill in the gap in their care and help with symptom management. And so we have patients that we can see out in the community in their home setting, or we can see them here in the clinic. A lot of times patients are still going to their specialist appointments, and so it's easy for them to pop over here to the clinic after one of their other appointments.
Yeah, there's so many questions about that, because you think about who can come to the clinic and when do they know the time is right for palliative care. And you kind of play, Becky, a really special role when it comes to the palliative and hospice, because you have kind of two job duties. So as a nurse practitioner, you really obviously take great care of our patients here at the clinic and in their homes, do a lot of admissions, work at the hospital with the other staff, but you also have kind of a special job with Fairhope and with hospice. Can you talk just a little bit about that role?
Yeah, so I do work for both palliative and hospice, and my role for hospice is to see those patients who have been on service for a while and do what's called recertification visits, just to maintain that they're still clinically appropriate for hospice services. It doesn't happen often, but sometimes you see a patient stabilize and get better on hospice, and that's usually unexpected. But if that happens, then palliative care may be a better fit for them. So what are those differences? Palliative care can be for patients with advanced illnesses who aren't ready for hospice, like Nicole said. But patients on palliative care can pursue those aggressive treatments, whether it's surgical procedures, chemo, radiation, and more aggressive life-sustaining measures, and receive symptom management from palliative care while they are pursuing those aggressive treatments. When a patient gets to a time where they're no longer wanting to pursue those aggressive interventions and they clinically fit hospice eligibility, then we can talk to them about hospice services. But palliative care really fills that gap between, hey, we're not ready for hospice services, but we've got a really advanced disease and a heavy symptom burden. So we really work to improve their overall quality of life.
Yeah, I think that's so important. And one of the things as we talk to the community and the physicians and our patients, the one thing that we like to explain to them is that in order for them to be admitted to hospice, they have to have a 6-month or less diagnosis of a terminal diagnosis. Now, none of us have that crystal ball, so we don't know if their days with us will be very short or longer than 6 months. But the difference is there's not that specific criteria for palliative. So palliative feels like it's been around forever, but it doesn't have a lot of the regulatory ties like you're talking about, Becky, where you have to have those certain things before you can be admitted to palliative care. So, we kind of look at that time frame, and you guys can answer this obviously better than me, but oftentimes if you've got someone who has had a chronic illness, it's starting to get worse. Maybe you look at maybe an 18 to 24 month period where they're still getting those treatments. We know that we can't cure them, but we know that that's going to get worse. So if you look at kind of that window, is that sometimes what you see with your patients?
I would absolutely say that's what we see with our patients. The great thing about palliative care is that patients are on our service for an extended amount of time, and we're able to build relationships with the patient and their families in order to find out what their goals are, to figure out how we would best be able to provide them with a quality of life, and work together again with the patient and their entire family to make sure that we're helping them with their quality, and still monitoring for when it would be time to talk about hospice, but being able to really, be patient focused and patient centered about what their goals of care are.
Yeah, and I think what's really important that you touched on is the fact that, our goal is, and our hope is that we provide to the community this wonderful opportunity, but it also gives that really smooth handoff from palliative to hospice, because that's a hard decision, it's a hard move, but they've really built their trust with you guys. You've been seeing them sometimes for months, maybe years. So when it's time for that, you guys have that really soft conversation, and then you can hand them off. They trust you, so they trust who you hand us off to hospice. So that's why we thought this was kind of the missing piece to the puzzle when it came to our palliative and our hospice plan. So we're just really excited about it. Let me stop for a second here and give you the information. So right now, currently, if you have any questions about palliative or hospice, even if you're just not sure which program fits you best, all you need to do is call 740-654-7077. Ask to speak to someone in intake. They'll get you to our intake hub, and then from there, they will get you to the right place and in the right direction. So let's talk a little bit about this transition. So since you both have been with us and since we've been doing palliative, you've been in your cars traveling, and we have not got a chance to talk about the hospital, so I think we'll save that for our second segment. But you've been in your cars traveling. So let's say with 300 patients, we have a total of 5 nurse practitioners. It keeps you on your toes. A lot of driving, a lot of windshield time. So part of what we had, our goal for this is that any of your patients who are really able to get out, maybe they're still working, maybe they're coming to the hospital to see their specialist, getting chemo, radiation, dialysis. You've heard from them that a lot of them want to come to a clinic. They don't want a lot of people in their homes. So for them to have a place to go right after their appointments, we hope is going to be really life-changing for them.
Yes, so when we go and see home patients, we can really only get to maybe 4 patients in a day is pushing it, just due to the fact that we serve Fairfield County and all the surrounding counties. So sometimes we're spending an hour to drive to someone's home and finding out that the clinic will allow us to serve more patients. Patients that are still homebound, we are glad to come out and make those visits. We are not taking that away at all, but we know that we can serve more patients by having them come to us in the clinic.
Yeah, and that's really been our goal, and that's the word we want to get to the community too, is that, you know, if you are still homebound and it's a true hardship for you to come into the clinic, then we have nurse practitioners that are available to come to you. So the thing that we're working on right now is really looking at what a good schedule looks like. So we have here from 8 to 4 Monday through Friday. We're able to schedule pre-scheduled visits for patients to come in. Mm-hmm. We've been working really closely with the hospital so that if there's someone at the hospital that has a need, we have the ability to move them into an appointment at their convenience. So that's really been the goal of ours. But like I said, we have 5 nurse practitioners, so oftentimes they're still seeing some patients in the community who are homebound and just are really not able to come in and see us. So if you have questions about how to get more information on the clinic, reach out, ask questions, please give us a call at 740-654-7077. And again, thanks for tuning in. Stay tuned. We'll be right back with Fairhope Hospice Today. What makes Fairhope what it is our staff. It's always a question that we ask, why do you want to be here with us? And what they most always say is, you've touched my life this way. You know, you took care of this person, or I've seen what you've done and I want to do that. And so the staff that have been here know what it takes. They've been on the other side. They see what it takes to make someone comfortable, to make the family comfortable, and really what kind of support they need. And so I think that's what really makes Fairhope what it is.
The Frankie Smith Funeral Home and Crematory in Lancaster and the Johnson Smith Funeral Home in Baltimore have a long and wonderful history of serving our community. Feel free to give us a call at 740-653-0652. Stop in and see us at either of our 2 locations, 405 North Columbus Street in Lancaster and 207 South Main Street in Baltimore. Respect for tradition, regard for change.
Greetings from Fairfield DD. As we embrace the back-to-school season, we welcome the arrival of autumn and our cherished fall customs. Join us for Football Friday nights and the county fair. While you revel in the colorful season, let's also reflect on the positive changes we aspire to witness. At Fairfield DD, our goal is to foster a vibrant community where individuals lead lives of greater independence and make meaningful contributions. Follow us on Facebook or Instagram to discover more about our unwavering commitment to the community.
If you've been thinking about getting a home loan, now is the time. Hi, this is Carrie James from Fairfield Federal. Our experienced lenders are here to help you make your vision a reality. For more than 125 years, we've been helping our community achieve home ownership. Fairfield Federal has convenient online application for your home loan, home equity loan, and home equity line of credit needs. Visit fairfieldfederal.com to get started. Fairfield Federal for checking, savings, and home loans. Data charges may apply, subject to credit approval. Member FDIC, Equal Housing Lender, NMLS number 402612.
Dagger Law has more than 110 years of experience in nearly every aspect of the law. When we're not just helping clients, we're helping the community. You'll see us at festivals, sporting events, and around town because we live and work here too. We are your neighbors, and we want to help you when you need it. When we help each other, we're stronger. Our community is stronger. Creating a strong, vibrant, healthy, and safe community is everyone's responsibility, and we take the responsibility seriously. We are local. We are trusted. We are experienced.
Managing your health can feel scary, but you are not alone. At Fairfield Medical Center, our network of healthcare professionals and compassionate caregivers are focused on one thing: supporting you. From primary care to specialty procedures and rehabilitation, we offer the resources you need to lead the life you love. Whatever you're searching for, you can find it at Fairfield Medical Center.
Hi, I'm Kristen Glazier, President and CEO at Fairhope Hospice and Palliative Care, home of the Pickering House, and thanks for joining us again for our second segment of Fairhope Hospice today. So we are in our new home, the Palliative Clinic, which is our AIM clinic at 1319 East Main Street, just around the corner from Fairfield Medical Center off of North Ewing. And I am joined today by two more of our nurse practitioners, and I'm going to let them introduce themselves today.
Hi, I'm Haley Worthman. I am one of the palliative nurse practitioners. I've been here for about 2.5 years now.
Okay. And my name's Alicia Grillo. I've been with Fairhope for the past 7 years as a nurse practitioner.
So in the first segment, we talked a little bit with Becky and Nicole, and unfortunately, Christina, who is our fifth nurse practitioner, wasn't able to join us today. But can you guys talk just a little bit about your roles here at Fairhope with Palliative? Tell us a little bit about what you do every day.
Yeah, so we help manage our palliative care patients. Nicole and Becky that you saw earlier, Alicia and myself and Christina, we all kind of have our own grouping of patients that we see. So we typically are following up with the same patients, which is why we're able to develop a relationship and a rapport. But depending on the day, depends on what our schedule looks like. Sometimes we might be in the community seeing patients, sometimes we might be here in the clinic, but we also provide coverage at the hospital here at FMC, and we do inpatient consults and see patients there as well.
I think that's a good point too, because your day could start out looking really clean and perfect, and then before you know it, things kind of go, I mean, I guess like it is with any type of an office, but still, you know, with you guys traveling to the community so much, you're traveling through weather, and you get to a patient's home and they've forgotten about the appointment, maybe they had something else to do, and so we're going to talk a little bit about how that's changing now here with the clinic, but tell us a little bit about your role here.
My role. So I've been with Fairhope for the past 7 years. We initially started with a community-based program, and over the past 7 years have watched it grow and blossom into such a great program to serve our community. Starting from a few nurses seeing patients within their home to then expanding to Fairfield Medical Center's consult service, and now being able to open up this wonderful clinic to better serve our community. It's wonderful.
I told them the last segment that when I started 8 years ago, and then you came right after that, we had this pizza party and celebration when you hit like 80 patients.
We
and I
did.
said, look at us today, look at us now. This is a whole new chapter. So
it's wonderful.
Yeah. You know, I think it's really important for us to talk a lot about our partnership with Fairfield Medical Center. You know, they've been great partners with Fairhope for 100 years, it seems like. But really for palliative too, that role has just really changed in a lot of ways. Can you kind of talk about the way that we support Fairfield Medical Center, their patients and physicians through the palliative program?
Sure. We're a consult-based service with Fairfield Medical Center, so the physicians and providers will invite us onto the case to help with the management of those particular patients. It could be anywhere from symptom management to establishing good goals of care and then following up in the community. And a goals of care conversation could be trying to figure out where we were, where we are, and what's coming up next in life in terms of their chronic health problems, and how we can best serve to keep them maintaining good quality of life as best as we can, and trying to stay out of the hospital.
Yeah, do you guys find that a lot of people, like, I think sometimes you are the people that are going in to have those conversations first. When you talk about care planning, advanced care planning, you're talking about like, what is your plan? You know that with palliative you have this chronic illness that we probably can't cure and will get worse, but how do we maintain that? And then it's really important to talk to the patients about like, what is your plan? What do you want?
Maintaining their independence to make their own decisions, and then communicating that to their loved ones or support people to help carry out their wishes is so important when it comes to chronic health care.
Yeah, I think that's a pattern that, you know, we've had a lot of conversations around at the hospital, with the hospital, is you know, these symptoms that people have when they have a chronic illness they're intense symptoms, and sometimes in the middle of the night or, you know, whenever they have that crisis, they go back to the hospital, and then that is just a roller coaster for them all the time. You know, it's hard for them to go in and out of the hospital. It's hard for the hospital, and it's just in the primary care physician. So I think our basic goal every day with our patients and at the hospital specifically is keeping their symptoms under control, keeping them out of the hospital, giving them good quality of life so they can go on and do the things they want to do.
Absolutely.
Yeah. All right. So can we talk a little bit more about co-managing? You know, what your role is, because you're not primary care physicians for these patients.
Yes.
You are not their primary care physician. So I think if you think about it like this, you're like a specialist. So if someone's going to go see a physician for a particular issue, you are the specialist for palliative care.
Absolutely.
So not a primary care physician, but what if they have their primary care physician and they also have you in palliative? What does that look like?
Sure. So we're an extra layer of support. We're not taking over care for any of their providers that are already established with them, whether that be other specialists, maybe a cardiologist or a kidney specialist, along with their primary care providers. We are going to collaborate with those providers depending on the symptoms we're seeing, the concerns we're finding during our visits, to help address the issues, to hopefully make sure their symptoms are managed, to improve the quality of their life and try and keep them out of the hospital. Yeah. So we're gonna work with their team that they already have in place.
So they don't have to worry about giving up their other specialists, their pulmonologist, their oncologist, or even their primary care physician.
Correct.
Okay. And I think from what I've heard and what I understand, the physicians, the specialists are thrilled that you guys are involved and as part of the palliative team. You know, they're happy because you guys are the experts in palliative care, and so they lean on you sometimes to just help them understand how to manage those symptoms a little better.
And oftentimes it stems around looking at life differently. When we visit specialists, that specialist is really focused on their area. And I find that our visits, we often talk about what makes the person happy, what gives them that joy within life, and how do we maintain that in terms of managing symptoms. But looking at life as a whole, stepping back and taking a look at healthcare as the whole person.
Do you think sometimes that the needs that the palliative patients have, because oftentimes their body is ready for hospice, they're philosophically not ready, or there's other things where maybe issues in their life that they are having struggles with, not enough food, can't get to their appointments, can't get their prescriptions, family, you know, they need advanced directives. So I don't want to forget to mention our wonderful social worker, Erin. So I think when the specialists see them or the primary care physicians, they have a little bit of time. We have a whole team here. So you guys can see them to manage the symptoms. We have a social worker that can help them manage those other things that oftentimes really can limit their ability to get the care they need at times.
And I would say fall through the cracks many times. They just don't get addressed.
Good point.
And sometimes, actually even very recently, I had someone explain to me that bringing in additional help was like losing more independence. And it wasn't until we had a conversation about the important things and preparing for a potential problem like a fall that she was really okay with bringing in more help, because she didn't think she would ever do it. She didn't think a bad thing would ever happen until we talked about that. And you know what? Now she's prepared. And that's something that would have been totally overlooked.
Yeah, I think that's a great job. And that kind of falls into line too with just preparing like advanced directives, because you know, when you're in that crisis, you have that fall, you have that emergency, you have to go to the hospital. That is the worst time to try to put all these things into place. So you guys are really privileged, and palliative is really privileged to be asked by the physicians to help manage all those pieces that are really difficult. So yeah, we're really proud of our clinic and where we're headed with this, but I want to touch a little bit before we have to go. But let me say this. So if you have any questions about how to become part of the palliative program, or if you're not sure if you need palliative or hospice, please, all you have to do is make one phone call at 740-654-7077. That will go into our intake hub, and they will get you to the right person to get that ball rolling for you. So let's talk about how we're reimbursed, because everybody wants to know, like, what's it going to cost me? How is that going to work? So Fairhope reimbursement is very different than palliative. Do you want to talk a little bit about what that looks like? And as you guys are considered specialists, you know, how we bill and what that looks like for the families?
Sure. When we receive a referral, the information is sent to our wonderful navigator, who goes through the process of making sure that the insurance is going to approve of it. Most insurances treat palliative care just like a regular specialty, and in which case it would be reimbursed very similar. There are some that require prior authorizations, and that's what we're happy to take care of beforehand.
And oftentimes, just like you would see a specialist or your primary care physician, there are going to be co-pays at times. So we do want our palliative patients to be aware of that. But, you know, just as we say with Fairhope, no one is ever going to be turned away for their inability to pay, and we're really proud that we can continue to offer that today, and that's because of all of you who offer us donations and support. But we also have a hardship form that our social worker can help to, if that copay of $20 or whatever it might be is a hardship, we can help you through that. So we continue to be really proud and really pleased of the services that we provide, and just how we don't ever want anybody to not receive this kind of care because they can't pay that bill. So we're very thankful for that.
Absolutely.
Yes. Yeah. So again, we are located here at Fairhope Palliative Clinic. It's the AIM clinic. If you'll notice on our sign out front, it's Advanced Illness Management, AIM, and it's at 1319 East Main Street, just down around the corner from Fairfield Medical Center off of Ewing Street. So again, if you have any questions, we really encourage you to make one phone call. That'll get you in the right spot. That number is 740-654-7077. Thank you so much for tuning in today with Fairhope Hospice today. We'll see you next time.
Interface Video presents Fairhope Hospice Today. Brought to you by Fairhope Hospice and Palliative Care, Fairfield Federal Savings and Loan, Fairfield Medical Center, the Fairfield County Board of Developmental Disabilities, Dagger Law, and the Frank E. Smith Funeral Home. The Pickering House on the campus of Fairhope Hospice in Lancaster, Ohio, is a place where people receive end-of-life care in a comforting, home-like environment. Constructed in 2007 and named after benefactor Virginia Pickering, the facility's initiative is grounded in Fairhope's deep commitment to a full continuum of care, where quality of life is a priority through the end of life. At the Pickering House, our team of physicians, nurses, social workers, chaplains, and volunteers attempt to bring the same warmth and comforts of home. Located on a tranquil and scenic bluff amongst 40 wooded acres, the Pickering House delivers personalized care with the kind of compassion that you would expect, because here, patients and their loved ones are all considered family. The Pickering House has 12 ample-sized and comfortable patient rooms. These spacious rooms allow privacy and provide comfort for family members spending time, day or night, with their loved ones. Families are encouraged to use the many amenities of home that the Pickering House is available to them. The large family lounge offers a kitchen for loved ones to prepare meals and snacks. They can also take advantage of one of the 2 three-season porches with great views of nature all around. A chapel, great room, family laundry, and family shower are just a few of the comfort features the Pickering House has to offer. More recently, additions have been made outdoors to accommodate the children who visit, including a play set and a playhouse. In addition to amenities for loved ones, the Pickering House boasts the finest in-food service for patients, with a staff who is dedicated to bringing joy to those they serve. Special food requests are taken to bring a smile to the guests of Pickering House. finally, our large facility easily accommodates families of all sizes, with plenty of private spaces for meetings, discussions, and reflections. It is the mission of the Pickering House for those who enter to think of it as a special place where peace, respite, spirituality, and love prevail. We welcome you to tour our facility or visit us online at fairhopehospice.org.